Fibroids are the overgrowth of the muscle of the uterus, and they can be seen on any age group, right from young women to up to the age of menopause. The sites of the fibroids can be in three different sites in the uterus, where it can be seen in the cavity or in the muscle of the uterus or outside the uterus. The patients can present in the form of heavy bleeding, that is menorrhagia, or pain during the periods, that is called as dysmenorrhea, or intermenstrual bleeding, or sometimes if the patient is postmenopausal, then she can present with postmenopausal bleeding as well. And some young patients can present with infertility. On examination, the uterus appears to be slightly enlarged. The treatment depends upon the patient's symptoms and the age. If the patient is young and wants the treatment for bleeding, then she can be treated medically with non-hormonal or hormonal medications. If the patient is come with a history of infertility, then has to be treated accordingly, and also the fibroid is bigger, then can be given an option for myomectomy. If the patient has completed her family, then the options vary in the form of medical management, or there are other conservative newer techniques like uterine artery embolization, or the last resort is the surgery. The surgery mainly involves either removal of the fibroid, that is myomectomy, or can have an hysterectomy either by open surgery if the fibroid is very big, or can be done by laparoscopically, or the newer technique is the robotic surgery. Now, robotic surgery has a greater precision technique compared to the conventional laparoscopy. Therefore, there is less blood loss, less morbidity, and less post-operative pain, and the patient can be discharged. The other option is the Mirena coil, which they can have it for 5 years, and that helps to shrink the fibroids. And if any further symptoms, the patient can contact to the doctor as per her wish. At Aster CMI Hospital, we pledge to treat you well.